I got a cold call one day from Bill Ravanesi to work with hospitals because we were polluters and because we were contributing to 10% of all the pollution in the country.
The healthcare industry is 18% of the entire U.S. economy. Hospitals are the second most intensive energy-using sector in the economy.
I said, you know, I've worked here a very long time, and if we're doing bad things, it's not intentional. Let's work together because we want to do better.
The work of our team in Boston, led by Bill Ravanesi and Paul Lipke, has created Boston as a model city for where the healthcare sector is leading the effort to address climate change and to reduce its collective climate footprint.
$100 million. That number surprised me because it's the amount of money that we spend on energy a year.
The challenge for hospital folks is to be able to look a little further out and recognize the broader responsibilities around the environment that is embodied in the work that they do.
Healthcare Without Harm, from a perspective of helping us to prepare climate action plans that reduce greenhouse gas emissions, has been the real leader. They've organized 21 million square feet of hospital space.
So we now know exactly how much energy is getting consumed by the healthcare sector.
Part of the success in Boston and the model that's been created for the rest of the country is collecting all the energy use data by building for all the hospitals in the city. And what it allows is it allows the hospitals to benchmark against each other and to find ways of where the best interventions are to reduce their energy footprint.
Healthcare Without Harm plays the role of being an advocate at a national level. There's the lobbying, there's providing that scientific information, there's supporting things like the Green Ribbon Commission in Boston.
Policy drives a lot of what we're doing. There are statutory mandates, governors who care about it, mayors who care about it, elected officials and appointed officials who care about it.
Governor Patrick is really focusing on climate issues and energy issues, which together are very closely interlinked.
Sandy resulted in a paradigm shift.
What did it mean to me? It meant that that can never happen where I work. I'm a facilities engineer, but they're still my patients the way I look at it.
We asked ourselves, how long are we building this building for? Roughly 75 to 80 years.
We're actually looking for an installation on the roof of the building, again, to keep it up high.
What is Boston Harbor going to be like in 75 to 80 years?
We're sizing it so that we'd be able to keep all of our inpatient capacity fully operational 100% for an extended duration.
Uh-oh, there's climate change. You know, the sea level is going to rise. And we are right on the waterfront. So what do we do about it?
The designs that we're doing are designed in such a way that the entire basement of our organization could be completely underwater, submerged, and we'd still be able to be fully functional.
I love these guys. They work very hard.
It really happened because of Healthcare Without Harm.
Getting all these people together, working together, and changing a city, changing a state.
Healthcare Without Harm is a voice.
If you can make changes in the healthcare sector, it can have a multiplier effect throughout the entire economy.